What's up, Dream Team? I am Shan. This is Dream with Shan. I am a second year family medicine resident. I'm currently in my block 12 of 13 blocks of this year, and then I'll be a third year resident. I chronicled my journey through residency, and I formally chronicled my journey through medical school, so check out those videos if you have any questions. As a non-traditional student, as a mom, as a person who dibbles and dabbles in a bunch of other things as well. So if that interests you, then make sure that you subscribe to the channel, like this video, and stay tuned for more. So I've got this question asked maybe once or twice, like how did I decide to go the MD route versus the PA route, or maybe nurse practitioner route? And just like to keep it really simple is that and as cliche as it sounds, like I've always wanted to be a doctor, like even from like a small kid, 4 years old. I told my grandma I was gonna be a doctor. At that time, of course, who knows what a doctor is at 4 years old? Some people may, but I can't think of my train of thought at 4 years old if I actually knew what a doctor was, or I had seen something and I decided I want to do it. But that was kind of like in the back of my head as I grew up. I've always like explored other interests and did other things, but when it came like down to like really pursuing or deciding to pursue a career in like high school and college, I kind of stuck with the go into medicine route. And at that time, I will say that years and years ago, there wasn't a lot of exposure to different types of medicine or different type of careers in medicine. I knew nurses and I knew doctors, but I can't really say I was very familiar with the PA or nurse practitioner. So for me, it was MD. You be a doctor. You want to go into medicine, you want to treat patients, be a doctor. So that's kind of like the short story of it. And then as I got as my journey became much more non-traditional, meaning went to undergrad, didn't go to medical school straight out of undergrad, worked for several years. I got to learn about PAs, I got to work with PAs and things of that nature, and I still kind of leaned towards the MD side just because of my preference and the amount of autonomy that I would have, even though you can have autonomy as a PA, but my wanting to kind of be the head and not anything else. And not to say that in a what's the word I'm trying to go? Not to say that in an egotistical way or anything like that, but I wanted to be the primary person to care for this patient without many restrictions, if you can say that. And in some states you do have restrictions, whether you're a PA or a nurse practitioner, and how you practice and things like that. And of course at that time I didn't know the gist of like regulations and all that. I just knew that the route that I wanted to go down was being a MD. I knew that it'd take 4 years. I knew there was residency. I didn't know how hard it would be. I didn't know how challenging some of the exams would be. I didn't know how challenging on the mental health and physical health and family that it would be at the time. I had an idea that of course it wasn't gonna be a cakewalk, but never did I imagine that it would be like it's been for me over these past several years. But I am here and where I am now. I'm a PGY2, so was it worth it? We'll see when I graduate from residency how much it was worth. Would I change things? I think PAs are awesome. I think nurse practitioners are awesome. I don't know if I would change things. So I do have a passion for it. The way that training goes and policies and things that kind of dictate how you can treat your patients, what you can do for your patients, is kind of discouraging. So those things kind of do make me question the route of medicine. Then I'm like, what would I do? What else would I do? And I do remember that my primary goal initially going into medicine was my grandparents, and just watching, specifically my grandma, watching her health journey. So that was very important to me, to be somebody that she would have been proud of, to be like her doctor, to help guide her on her comorbidities and hopefully, help improve them. So I kind of keep that in the back of my mind every time I get a little discouraged about medicine or my journey, or the fact that, I'm not where I wanted to be at this particular point in life and time. So that answers the question on MD versus PA versus any other thing. Again, it's just what I decided to go into. I think that I will tell anyone who is deciding to go into medicine, do your research. For you, 2 years of training is what you would prefer to do versus 4 years in specialty, then I say go that route. Or if you want to, get a BSN in nursing and then go to get your nurse practitioner license, then go that route. Just make sure you've researched it and it's not based on what you see, what you think you can earn, and other things like that. Just make sure it's something that you really want to do based on your own passion and your own kind of like goals in life and in medicine. So that is it. Again, if you are new to the Dream Team, make sure you smash that subscribe button, like this video, share this video, and I'll see you in my next video. All right, people.